Um, okay. First of all, welcome to the founding cohort. I will go over this story that probably most of you heard a bit of it or in parts, but it's really important to how we got to where we are today. Before I must start that before I was a teacher, I was a patient. It all started in 1999. I was a soldier in the Israeli army. I got Crohn's disease and was hospitalized in the military hospital. 3 months in the military hospital, and they couldn't find a solution. So I lost 37 kilos. The doctors had no hope. No medicine helped. No treatment helped. I kept bleeding inside, and it was frustrating for everybody. Thankfully for me, and luckily for me, I had a doctor who was a gastroenterologist who volunteered to take a second shift as a reserves military doctor. And he met with me and gave me 5 roll joints and told me, try this. It might help. Now, I must tell you, it helped. I ate a full meal plus for the first time in 3.5 months. I kept it in. But then after I told this to my GP back home after the weekend, after I was released and I was back to the army, and I told that to my military doctor, he picked me up in the air. He turned paler than the wall behind him. And he told me straight to the face, he kind of screamed it at me. I'm trying to save your life. Why are you trying to destroy mine? Now, what I didn't know was what he saw in his imagination at that moment. He saw himself in prison for 20 years, as it was the minimum mandatory imprisonment time if you were found dealing drugs in the army, which by definitions of him being my doctor and administering me cannabis, which was illegal, he was doing. At that moment, I had an epiphany moment. I just understood how bad I was understanding the world around me. And it was kind of those moments that are life defining. I understood that I could either live my life as an outlaw or change the law. I mean, the reality of life couldn't continue. Now, I knew that there was the path of going through the courts. 6 patients have done it before me. But I decided that I'm going to go to the Ministry of Health legal team and ask them, how is it possible that this medicine helps me and I cannot obtain it legally? Well, 6 patients already been approved, as I told them, and it took a lot of time, 4 years until I actually applied. When I imagined it's going to be an easy application, it turned out to be a chaos. I needed to collect so much data. I found myself in kind of a Kafkaic situation where back at the time, just to remind you, we didn't have email communication with the Ministry of Health. It was all done by mail. I had to wait 2, 3 months for a reply every time and then send them more documents. At some point, I had to send it via courier. I faced this bureaucracy alone. And after this journey, I had 400 pages of clinical trials and medical documentation that went back and forth with the Ministry of Health, and 600 pages of my own journaling, of my own path, of my own way, just to prove to them that medical cannabis works for me. One was for them, the other was for me. And then, 4.5 years later, I became the 7th patient in Israel. The first, the first one to go through it without the courts. Why did it matter? Because it allowed me to found the Israel Medical Cannabis Association, to open the gateways of the Ministry of Health to a lot of patients, which led them to end up licensing me as the first medical cannabis coach in 2008. It was the beginning of the cannabis era, of the medical cannabis era in Israel. The whole administration did not exist as it does today. We're talking about a few doctors working in a medical capacity at the mental hospital because that was their day jobs. And they were licensed by the Ministry of Health to lead this entire medical cannabis program. Now, they had to have some help and they didn't know anything and neither did I. So it took a long time to develop the system. And then it took 3 more years until we got to 2011, the first nurses class for medical cannabis. This changed everything. This allowed nurses to work in the capacity of their profession in the hospitals and in the elder community with cannabis. They could administer, well, the doctors actually prescribed, but they administered the cannabis to the patients. They followed up. They made sure they take it on time and so on. And for the first time, patients who got to the hospitals to be hospitalized and had a license for cannabis could use it at the hospital. 15 years later, teaching and lecturing, sharing knowledge, changing lives, doing it mostly for companies and ministries of health around the world, led me to the understanding that the system just doesn't work. It's broken. And that's why this cohort exists under a privatized kind of thing, directly me to you, open to whoever wants to participate, not railguard by the administration, the government, or a company. That's what we're doing here. The Wizdom Masterclass is about learning how to coach patients to not go through the same ordeal as I have, not to need to learn the entire encyclopedia, not to need to file 400 different medical documents and journal themselves for 2 years before any doctor listens to them. Now, we're seeing that complex systems need accountability built around them. Cannabis is a very complex system. The prescription exists, at least in most of the places. What doesn't exist is the actual architecture of accountability around them, and that's what the coaches are. So I built this system of accountability as coaching. And this course is basically for the person who does it for the others. That's you guys.